A miscarriage is an event that results in the loss of a fetus before 20 weeks of pregnancy. It typically happens during the first trimester or the first 3 months of the pregnancy. Miscarriages can happen for a variety of medical reasons, many of which aren't within a person's control. But knowing the risk factors, signs, and causes can help you to better understand the event and get any support or treatment you may need. Here are 8 foods and beverages to avoid or that can lead to your miscarriage. Number 1. High-mercury fish. Mercury is a highly toxic element. It has no known safe level of exposure-trusted source, and it most commonly found in polluted water. In higher amounts, it can be toxic to your nervous system, immune system, and kidneys. Since it's found in polluted seas, large marine fish can accumulate high amounts of mercury. It's best to avoid high-mercury fish while pregnant and breastfeeding. High-mercury fish you want to avoid include shark, swordfish, king mackerel, tuna, marlin, orange roughy. However, it's important to note that not all fish are high in mercury. Number 2. Undercooked or raw fish. This one will be tough for you sushi fans, but it's an important one. Raw fish, especially shellfish, can cause several infections. These can be viral, bacterial, or parasitic infections such as norovirus, salmonella, and listeria. Some of these infections may only affect you, causing dehydration and weakness. It's advised to avoid raw fish and shellfish, including many sushi dishes. But don't worry, you'll enjoy it that much more after the baby is born and it's safer to eat again. Number 3. Undercooked and processed meat. Some of the same issues with the raw fish affect undercooked meat too. Eating undercooked or raw meat increases your risk of infection from several bacteria or parasites. Bacteria may threaten the health of your little one, possibly leading to stillbirth or severe neurological illnesses, including intellectual disability and epilepsy. Hot dogs, lunch meat, and deli meat are also of concern, which is sometimes surprising to pregnant people. These types of meat may become infected with various bacteria during processing or storage. Pregnant women should not consume processed meat products unless they've been reheated until steaming hot. Number 4. Raw eggs. Raw eggs can be contaminated with the salmonella bacteria. Symptoms of salmonella infections include fever, nausea, vomiting, stomach cramps, and diarrhea. To be on the safe side, make sure to always cook eggs thoroughly or use pasteurized eggs. Save those super runny yolks and homemade mayo until after the baby makes its debut. Number 5. Organ meat. Organ meat is a great source of a variety of nutrients. These include iron, vitamin B12, vitamin A, zinc, and copper, all of which are good for you and your baby. However, eating too much animal-based vitamin A is not recommended during pregnancy. Consuming too much preformed vitamin A, especially in the first trimester of pregnancy, can lead to congenital malformations and miscarriage. Number 6. Caffeine. You may be one of the millions of folks who love their daily cups of coffee, tea, soft drinks, or cocoa. You are not alone when it comes to our love of caffeine. Caffeine is absorbed very quickly and passes easily into the placenta. High caffeine intake during pregnancy has been shown to restrict fetal growth and increase the risk of low birth weight at delivery. So keep an eye on your daily cup of joe or soda to make sure the baby doesn't have exposure to too much caffeine. Number 7. Unpasteurized milk, cheese and fruit juice. Raw milk, unpasteurized cheese can contain an array of harmful bacteria including Listeria, Salmonella, E. coli and Campylobacter. The same goes for unpasteurized juice, which is also prone to bacterial contamination. The bacteria can be naturally occurring or caused by contamination during collection or storage and can lead to malformations and miscarriage. To minimize the risk of infections, eat only pasteurized milk, cheese, and fruit juice. Number 8. Alcohol. It's advised to completely avoid drinking alcohol when pregnant, as it increases the risk of miscarriage. Even a small amount can negatively impact your baby's brain. Papaya. Papaya, and especially green papaya, is believed to cause miscarriage. The reason behind this is that green papaya contains an enzyme that can cause uterine contractions, leading to miscarriage. Pineapple juice. Pineapple is commonly used at the time of delivery to make the process fast and easy. Pineapple contains bromelain, which can make uterine muscles smooth and thus lead to miscarriage. If you consume this during the first 3 months of your pregnancy, this may cause miscarriage. When you are pregnant, it's essential to avoid foods and beverages that may put you and your baby at risk. Although most foods and beverages are perfectly safe to enjoy, some like raw fish, unpasteurized dairy, alcohol, and high-mercury fish should be avoided. Plus, some foods and beverages like coffee and foods high in added sugar should be limited. If you like the video, then please hit thumbs up and subscribe.